Мы можем начинать.
Отлично.
Замечательно. Okay, ladies and gentlemen, good day to everyone. Welcome to our healthcare event that Sova hosts now traditionally at the beginning of the year. Healthcare is quite an important topic for all of us, given the continued pandemic and the developments around the world. Pleasure to start this event today with United Medical Group, or EMC, and pleasure to have with us today the CEO of the company, Andrei Yanovsky, and the CFO, Andrei Shemlev. So without any holdups, I'll pass the word to Andrei and Dmitry to give you the latest update on the company.
Let me start, ladies and gentlemen, from the figures, and I suppose that more operational aspects you will ask during the Q&A session. In the reality, I would start from the word or from the words that we are strictly following the plan which was announced during our IPO. So all our projects which we announced, all figures which we promised to our shareholders, we are delivering. I mean both the growth in revenues which we had during 2021 and EBITDA level, which we got on the level of 40+% EBITDA margin. I mean, we keep, and according to our future plans, we do foresee that as the real basis for the further steps. What is very important that we are growing on the operational figures with visits. We are growing with our checks, which we do present to our customers, and it's very important to stress once again that the quite impressive, as we think, growth is delivered without any corrections in pricing. It's delivered by the complexity of services which we are providing. So as soon as we said about a year ago to you that we are provider of the most, let's say, high quality medical service in this country, as soon as we mentioned that we always compare or benchmark ourselves with the best players worldwide, and we are using for that all figures which are available for us because we are covered with JCI standard, and in the very end we do clearly see what was reached by us on the side of clinical KPIs and on the level of services we are providing to the customers. We can stress that yes, we are quite in line. We are quite in line with our positioning, and we still think that the most competitive zone for us is Germany, Switzerland, South Korea, and so on. So we'd like to stop our Russian traditional tourists, which were flying out to get these services outside of Russia, and we will hunt for these additional volumes in the coming future. If you see the CAGR, which we are showing since 18 to 2021, you do see that it's always higher than 20%. Again, in 2021, revenue grew up 26% in rubles and 20 in euros. It's quite, let's say, impressive because it's higher, or the tempo of growth is higher than the market itself. It's also very important to mention that all this money came out from the, let's call it, non-COVID services, because we are still staying out of closing or devoting our facility or any of our facilities for the COVID inpatient departments. Yes, we do have different type of diagnostics. Yes, we do assist our customers with problematics ambulatory at home, but we do not have desire to discount our actually volumes on the COVID, which will come definitely next year for sure to the whole actually industry. So we keep growing, keep increasing the depth of our competency in all 57 specialties. We are straight on the planned medical service. And that's why the level of marginality is so high compared to any other player. Because it's a planned, we know for sure what we are going to deliver and how we are ready to do that. The number of customers also is growing, and as we showed each year, it's 10-12% newcomers to our territory. It's also very important to mention that our major target is focused on the 360 degrees approach. So it's not just to say that it's the patient-centric approach. It's the care which we do deliver to our customers, because we are thinking not just about any kind of treatment, but also about the preventive side of the story. So the major instrument for us, it's the health plan, annual health plan for the customer, where we can actually appoint all targets, all aims which our customer do have, what he wants to reach, and assist him or her with the best actual results we ever can deliver. So in several words, it's the thing we'd like to deliver to you as the picture that we are following or straightly following actually directions which we mentioned. If you remember, during IPO, we said that there are 5 major strategic actual initiatives we'd like to follow in the closest future. First of all, it's to be the best in class and to deliver all kind of actually medical service which is needed on the market and on the commercial market of medicine, and be actually the best in class. Definitely develop further our oncology platform, because we are the major player in this country and the deepest actually in competence-wise actually side of this story. We also exploit this experience in the field of MHI, actually, where we are working with the state, and it's also clear to say that we are covering around 50% of the market in Moscow and Moscow region, delivering to actual state the services in high technological medicine and diagnostic. We are actually making further steps with the project of digital hospital, because we always stress that it gives us possibility to be quick, communicate the right way, actually put out all unnecessary notes of communication with the customers to make our business processes smoother and faster and more effective. And on the other side, to have a positive effect out of that, so to cut costs. As well as the my team actually, once again, I will recall you that my team consists of professional managers from all industries you can meet in Russia, not doctors, just the medical part of the story is covered by extremely professional doctors, and that's actually gives me a possibility to continuously improve the efficiency of our business, because we are working on a daily basis on all kind of business processes, and we are working with the market, trying to get and construct the best actually cost structure on our side. may I ask you, Dmitry, to continue with some more figures?
Let's come back with figures. As Andrei mentioned, our total revenues has increased by 20% last year, and that was an acceleration of the growth we have stated for last previous years. That was 11% in euro terms, and our growth in Russian ruble terms was even faster than before. It was 26% and 28% in terms of strictly medical services the company is providing it to its customers. And I also should underline once again that our price list is established in euros, and that's why we are feeling quite comfortable during each financial or currency crisis on the market. And as Andrei said, I also should remind you that the growth in visits and in average check is supported by our programs of 360 degrees that is providing to our customers and patients full cycle approach to their health, preventive approach to their health. And of course, it is continuing, it's also factored by continuing increase in complexity of the services the company is providing each year. Just I should remind you that we are consisting of 57 specialties at the moment, and that is a full cycle of medical services on the market represented by modern medicine. And when even new specialty will appear, of course, it will be on the board of EMC. So I propose to shift to Q&A session, and if you have some points you want us to cover, please let us know.
Dear participants, you can use the Q&A option here in the Zoom and send your questions through the chat, or you can ask to unmute yourself, and we will unmute you. Sorry, and you can ask your question by voice.
While we're waiting for people to come up with the questions, why don't I start with some of the ones that I had in my mind? Digital healthcare and the digital platform. Obviously, we all saw it as, as human beings and as patients. New developments, new trends are appearing. You spoke about how digital hospital is impacting on your cost side. I wanted to hear a little bit more as to how do you use your digital hospital on the revenue side of things? How does it help you to monetize, increase your paychecks? Does that impact the number of your outpatients? And the dynamics that you're seeing in that development, the use of the digital hospital, how much of usage you get from your app. I'm a big user of your app, so I know how it works, but I'm happy for our audience to hear about it as well.
Thanks for the question, Alan. I will start with the figure, which is 37%. This is active base out of all of our customers who do use mobile application already on the constant base. Yes, it depends on the ages. I mean, ages of customers. The depth of the use is a bit different. Younger you are coming, the number of different services will grow. And definitely people are starting with ruling the schedule, making appointments with the doctors, especially during this, let's say, a bit panic period of time. They'd like to sometimes use distant services rather than to go and see the doctor, if especially we are speaking about the consultation or the secondary consultation especially. Definitely they use it more and more often when they need to discuss the results of any kind of diagnostic, for example, and discuss the plan for the future treatment, rather than to see the doctor and wait, for example, for the possible appointment. As well as the other side of this digitalization, which we are really focusing on, is the side where we are collecting from different devices, different information. When we interact artificial intellect, where we are analyzing it, where we are contacting the customer and preventively actually already ready to discuss what we are to do in the next coming future, while suggesting more and more each day new services. I can give you clear examples. During IPO, I was widely actually using the example of Tighter Care, where we can actually be in contact with the mom, for example, which is a bit nervous about her child. Now we can discuss what another part of audience is widely already used, is the analyzers, which actually works with the gases you are actually throwing out of you and make an immediate diagnostic and making the plan how to continue or how to change the way you feed yourself, what kind of food you can use, and what will be the best actually way, rather than we used, for example, previously the analysis of blood, and it takes more time. It takes some more blood actually out of our customers. Now we are free out of that, as the example. And it's also very important that especially during these 2 years when a bit nervous atmosphere took place, where people didn't want to travel too much, even inside of the city. For example, psychology and mental services actually grew up quite rapidly. So people asked for additional support. People asked for distance services with psychiatrists. Actually, that was the major or the first specialization which attracted the most of the customer. But step by step, people are becoming more and more often users of different type of electronic services. And yes, if you ask me, show me please how much money do you earn through this channel, you're absolutely right. It's just 1 or 2% in the total revenue of the company. But let me use another example. Last year, 2021, we already delivered 12% of our revenues out of the other regions, I mean, other than Moscow and Moscow region, which means that I contacted the customer, I received the information, I used to work with it, we created the preliminary plan, and then we invited the customer on the territory and for the planned service. So 2 things happened. First of all, we cut time, we cut expenses on the side of the customer, we planned our service, and we mentioned it several times that only planned medical service could be profitable. And another thing is that we are a nationwide player while sitting in one place.
So, thank you so much for a very extensive question. And given that you're one of the largest players, we have a few questions coming in. One of them directly leads us from Vitaly in terms of, can you elaborate on your growth strategy for the next 5 years?
Clearly, yeah. I mentioned the directions which we are going to use for this growth. Let me start from the recalling point. We did invest in our business quite enough for staying out of any major or serious investments in the coming 3-4 years. So we do not need any kind of new hospital or, I don't know, clinic, because we invested during the last 13 years 450 million euros, which created the infrastructure quite enough to build the next step. If you remember today, I mentioned that we keep growing the stream of newcomers on our territory. That's actually give us understanding that utilization, which we have on this particular moment, inpatient department around 60% and around 55% outpatient department, still is a good actually way to go to grow and to fill actually this territory with the new services in the coming future, without additional actually money put into the process. I mentioned that unfortunately during these last 2 years we as professionals unfortunately got additional number of customers who stayed out of availability in normal medical service in oncology. And you know that people traveled less inside of the country. They asked for additional help on the state-owned hospitals, and there was a refuse, let's call it quite honest way. We knew that historically about 650,000 new cases appeared annually in this country. During these 2 years, you can add about 20% growth, because everything was devoted just for COVID, and all actual financial streams from the state were devoted to one particular actually specialization, rather than to continue normal supporting the population. So we do feel already this stream, and for example, the quite visual effect which we can see is the Moscow International Oncology Center. From 8 o'clock in the morning, it's a line of people who are staying and asking for assistance here. So that's the platform we can grow steadily. The good thing, we have the team of doctors, we have professionalism, and we have infrastructure in place. So I don't know whether I answered your question fully or totally. Please do not hesitate to specify if you need something more.
Sure, there's some additional follow-up questions. What is the long-term target of your hospital count? And can you provide any details on your hospital unit economics?
Unit economics?
Это основа рентабельности госпитализации. The first question about long-term target of hospital count, and we are several times reiterated that the company at the moment is pretty good invested, and for the growth in medium term, we do not need to invest a lot in this business. From commercial side, for example, as you remember, we have discussed with you that our load of capacity is about utilization of capacity is about 50%. So But I should also mention here that at the point when we are facing the need from the customer side of adding of new hospital counts or beds, we are adding it, but not as a huge investment and a huge expansion of number of beds, but we are adding it as a number of beds needed for 1 or 2 years ahead. So that's why we have such a good return of on investments, and we are not staying idle for years. And another question is about what is hospital unit economics. Surprisingly, I should not give you any special answer here, just because our economics at inpatient department is not much different than in an inpatient department. So maybe I should mention here that, of course, for the company, in order to meet the requirements of high quality medical services we are providing, of course, we should buy European and American international recognized producers of consumables and medicine. Of course, we are operating with up-to-date modern equipment of highly recognizable producers of medical equipment on the market. Of course, the company, in order to operate for the needs of our customer on the proper level of service, of course, our doctors should be highly professional, and they are not do not cost us less than for our international players. And of course, in order to be closer to our customers, all our locations, most of our locations, are concentrated in the very center of Moscow city. And here, of course, real estate costs not less than the same in New York. Maybe compared New York with New York, not a good comparison, but in Berlin, in Switzerland, and so on, in the biggest capitals of Europe. So from that point of view, of course, that's why this point is supporting why our strategy and our business model focused on providing customers of European international level of service is supported, or should be supported, by cost structure coming from resources we are attracting throughout the world, the best in class, I mean.
Let me continue actually with these last words of Dima and answer how do we attract and retain the talents. It's very important for us because as the major actually characteristic we like to see on the board is each doctor should have, or to be the owner of license, international license, methodic, or the technique. So that's actually creates the competitive advantage we do have on the market. Yes, we are looking for them around the world, and you know that on board we do have and foreigners and Russians who used to work, study and work outside, who got the license. And I don't know, the best example actually, or the biggest example I can show you is the Institute of Oncology, which consists of the major players which we got and from Israel and from States and from Germany, combined in one actual place, together with the equipment which they can use for R&D and for further actually exploration of the most effective ways to treat this problematic disease and diseases, probably the best way to say, and that actually creates the possibility for them even to get international patents on this territory. The complex of the interest in work and the good compensation, which we always place on the basis of gross profit, because I'd like to share with our key players the full effect that they create, gives me the possibility to say, first of all, that I'm an employer of choice. It's proven actually, and you can see that on daily basis we do receive new actually calls and new CVs, those who wants to join us. And another thing is the turnover. The turnover between doctors is less than 1%. And to be honest, in many cases, we are actually, I mean, the administration is the initiator of stopping the contract. Why? Because of two things. We do have responsibility for the most efficient, let's say, clinical treatment, which we are delivering, and there are clinical KPIs, which we tracked, as I mentioned earlier, from the world best actually players, as well as the values which we do have on our territory, and which we put into all kind of procedures, business processes, and which we tracked on the very clear actually way. The way you behave, the way you communicate with the customers. That's actually the major story for us, which differentiate us from any other player, and that's actually attracts at the same time talents on my territory. I also would like to answer another thing, and starting from M&As. We mentioned that we never stopped with our development, and we never work with the closed eyes. So we are tracking actually the territory around, looking for those opportunities which can deliver additional synergy to us, or we can study in order to understand what we can attract on our territory and develop on our territory. The good thing, once again, to stress is that in order to develop something additional, we do not need to invest too much. For example, on the territory of Moscow International Oncology Center, I still do have around 10,000 square meters, which are made shell and core during the capital reconstruction, and waiting for the clear idea which will be profitable and which we can use in the coming future. One of the ideas actually which we are working on now is the hematology, the thing which is not so widely, let's say, widely available in this country, and that's actually the territory which can give additional profitable growth for us. Will you continue, please, with the questions?
Sure.
Here we are. Sorry.
Sure. I can read them out. That's fine. Going back to your competitive advantages, one of the questions that we had was, given the private sector companies that operate in your competition, and you rely on the inbound tourism, you rely on affluent mass market in Moscow and Moscow region. It's very good to hear that you're getting some regional clients coming up. But what is your competitive advantage? How do you, retain those clients? Because, customer conversion is a very important aspect. How do you position yourself versus your other peers in the market?
There are two things actually which need to be recalled once again. First of all, it's the multidisciplinary approach and multidisciplinary facility which we do have inside of our system. So it's 57 specialties, which give me a possibility to stay with my customer since they decided to delivery, for example, or make an IVF session, and up until geriatric center. So the LTV could be extremely long and quite big money-wise. At the same time, don't forget that I mentioned that my approach is based on the additional values, or let us use traditional wording as the value proposition, when we are suggesting not just come to visit me and I will treat this specific problematic which you can announce by yourself, but to have preventive approach and delivering health care planning. So two key words. First of all, it's health. So I'd like to keep you healthy, and it gives me much more stronger LTV streams, as well as the care. So we do have a special department, service department, which is to deliver a bit different type of care to our customers rather than you can find around. Sometimes I think that we can deliver even more than our customers traditionally can find outside Russia. So taking all that into consideration, we keep this territory quite unique. And yes, it's a tough task because we are quite big, but we are ready and we are continuing to invest into that. Service, service, and service. One of these three is the medical service. All others is the service which we consume as the regular or the common humans.
Understood. Thank you. Yegor, do let me know if that answers your question as well, or there were some additional comments that we wanted to get from the company. One of the other questions that we had come in, and you mentioned it early in the presentation when we were talking about oncology, and in terms that the private sector, given the development of the state healthcare system, is heavily participating and providing services under the mandatory health insurance. So the question was, can you provide the mandatory health insurance share in the revenue of EMC currently, if it's possible? Do you do the split in terms of how much you get from that sector? Thank you.
Yeah, thank you for the question. I should say here that the share of MHI revenues is quite stable in our revenue structure. Now it is about 19%, and as we mentioned before, it is not our target to massively increase share of our revenues in that area, just because we are quite cautious and we are responding on adherence of new demand from Moscow government. So that's why our revenues from that part not growing faster than all our revenues.
I will probably add that we do not like to be too dependent on the state because of two reasons. First of all, we do earn much more from the commercial part of the story, as well as we do not want to devote our or more of our square meters to the, let's say, mandatory healthcare insurance customers. If you understand the major difference between commercial and mandatory healthcare insurance plans, in the second one, there is no service line at all. It's just a medical composition which is covered by the state tariff. If state tariff wouldn't be too attractive economically, we'd like to move and turn it to the commercial part. I will illustrate it as the possibility which started to appear because the market is underfinanced, underdeveloped, and the number of people who wants to get MHI tariff compensation, but they can't actually get this quota out of the oncological service line of state. They do see that on our territory, either additional service or the thing they really do need, but it's not covered by the tariff, or they can't get a quota, is available, they starting to pay out of pocket. Yep, we do not ask them for extremely high pricing. It's the same prices as the tariff, but it creates the new, let's say, sub-segment, which internally we call MHI Plus. And we do believe that as soon as we do see that in our, let's say, federal budget, and you can analyze that, the part which is devoted to MHI is not growing as fast as it should be, it means that the demand for out-of-pocket services will slightly grow. And here we are ready to deliver it.
Okay, I think we've covered most of the question. One, I think that is still remaining, and again, going back to your to the market. We spoke about the mandatory health insurance, and if we go in turn to the voluntary health insurance, some of the statistics that I saw is if you look at the Russian population, only 10%, just slightly above 10% of population actually hold the voluntary health insurance, surprisingly enough. Given that, can we speak again about the addressable market? Can we go back to the question of the addressable market for the premium player like EMC? Where do you see the synergies and how do you think about them given your high margin structure? How do you see the market involvement? Today's announcement that Rosatom has bought 25% in MedScan, and apparently the idea there is again moving to oncology and providing services over there. So what are the current, what is the market? How does it look like? If you can go, I can see you already opened the slide. So
yeah, it will be easier to illustrate
Sure.
what you mean, that the market is huge. Let's call it huge, and the opportunities for EMC, the very small player on this field, for next 10 years is just bright. Everything depends on our desire to move and to move faster. So paid services, if you can see, have just extremely low share compared to all others which are delivered by state-owned hospitals. When you mentioned in the very beginning voluntary healthcare insurance, unfortunately, it's not growing, and it's either if it's growing, the coverage of these particular programs is extremely weak, or let's say poor. When we are speaking about any kind of serious problematic, serious stories like oncology, in many cases, they will refuse to provide you with such or needed actually expertise and needed assistance. That's why we are saying that in this particular country, when the number of beds which provided by state is going down yearly, steadily, when according to the official program, the first hospital actually, multidisciplinary hospital, will appear in the city with population more than 100,000 people. On all other countries, there will be nothing, just the felchers small locations. That's it. So that's create huge opportunities for future growth for the private player. And we do believe, if you recall, in the very beginning, you asked, do you believe in these distance services? Do you think it could deliver? I can show you two things and answer another part of your question. First of all, don't forget that 2 weeks ago, for the first time in our history, it was allowed to make a diagnosis distantly here in Moscow. If you show, sorry, not show, but if you mention actually COVID, let's say, COVID symptoms, they will actually prove the diagnosis and give you a possibility to stay at home immediately, and even will deliver you QR code. What does it mean? It means that they are testing whether it's already time to change legislation. And I'm sure that legislation will become more and more and more attractive for players like we are to get in contact with customer and use our competencies earlier. If you remember, I said we can get information, we can get data, we can use artificial intellect and blah, 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 and be of help to this customer. Now, the second part of the story. You mentioned Rosatom Healthcare, wonderful, huge player on the market with no expertise in the medical service, with no actually normal facilities, and with tons of plans. They announced thousands and thousands pages of different plans, and finally understood that, okay, we had to buy something. Otherwise, how to deliver something visual on the market. And they actually announced a deal with the player, which, let me say, represents the very middle of the market, with wonderful ideas and with no serious projects in the reality. What it means that the market player do have too much credits and responsibilities or liabilities to the banks, and on the other side, the player with the ownership of the state and with the obligation to deliver some kind of a project finally. I hope that they will have some kind of success in the coming future. Let's see. In the reality, and that's actually gives me or delivers to me some positive things, that when you're playing on the field of medicine nowadays, you are to react to the market extremely quickly. When the, let's say, service animal becomes bigger and the states come in, it makes you a bit more slower. Good news for me. We will actually be more hungry for the next coming future.
Great. Thank you. A few macroeconomic aspects, given everything that's happening in the world. You are a euro, well, your functional operating currency is euro. So twofold question. One is, given the high inflation and given that the real disposable income of the population is reducing, and if, for God's sake, we see a strong ruble devaluation and, let's say, I don't know, euro hitting 120, do you see this as a big risk in terms of solvency of your patients? And if there is a risk, how do you manage it, or how do you address it internally? What are your scenarios as to worst, best case, and how you approach it?
Look, we do have very positive examples in our history. As soon as the company is 33 this year, we actually do remember 1998, 2008, 2014, and even several days before today, some kind of other crisis. Nothing happened. People are still do plan to be healthy. The most of our, let's say, audience do prefer to keep their savings in different currencies. They do actually buy on a regular basis, and a lot of actually this demand depends on me, which is good. So if I will communicate positively and attractively, they will increase the frequency of use. That will drive my future streams. I definitely need to be honest with you and mention that during the peak of the crisis, of each crisis actually, it happens the same way. The number of services in the field of plastic surgery and cosmetology are going down, and at the same time, the number of services at the psychiatry and cardiology are growing rapidly. So they are balancing each other. And if you see all mentioned actually years, there were no drop in our development. We are steadily growing and growing. So I would say another way, I have to be ready to meet any kind of demand in any of my 57 specialty each day, and be in contact with my customer. That's my strategy, and that will deliver a positive result.
Great, thank you so much. Quite a very positive note to almost end our conversation. Any last minute questions from anyone in the audience? I think we've answered them all. Well, thank you so much for being with us today. On that optimistic note, I wish everyone to stay healthy. And thank you so much to Andrei and to Dmitry for being with us today and sharing their views on the company and on the state of affairs. And thank you for the audience for your participation today.
Thanks, ladies and gentlemen. Thanks, Alina.
Thank you.
We are always of help here. Just call.
Thank you.
Thank you.